Good afternoon, everyone. Welcome to today's update. My remarks are going to be a little bit longer than normal because there's one issue, the issue of air bridges, I want to update you on today, and it is a bit complex, so I'll take a little bit of time to go through that. But firstly, let me start with an update on the latest figures. Since yesterday, an additional 7 cases of COVID have been confirmed, which takes the total number now to 18,309. A total of 767 patients are currently in hospital with either suspected or confirmed COVID, which is an increase of 68 overall since yesterday, but it includes a decrease of 18 in the number of confirmed cases. As of last night, 11 people were in intensive care with confirmed or suspected COVID, which is an increase of 4 in the number that I reported yesterday, but that increase is all in suspected cases. And since 5th March, a total of 4,106 patients who had tested positive and required hospital admission have now been able to leave hospital. Unfortunately, in the past 24 hours, 1 death has been registered of a person who had been confirmed as having the virus, and that takes the total number of deaths under that measurement to 2,490. In addition, National Records of Scotland has just published its more detailed weekly report. This includes deaths of people who had been confirmed by a test as having the virus, and also cases where the virus was entered on a death certificate as a suspected or contributory cause of death, even if its presence had not been confirmed by a test. The latest NRS report covers the period to Sunday, 5th July. At that point, if you recall, according to our daily figures, 2,488 deaths of people who had tested positive had been registered. However, today's report shows that by Sunday, the total number of registered deaths with either a confirmed or a presumed link to the virus was 4,173. 17 were registered in the 7 days up to Sunday, which is a decrease of 18 from the previous week. And this is the 10th consecutive week in which the number of deaths from the virus has fallen. Deaths in care homes made up less than a quarter of all COVID deaths last week, and the number of COVID deaths in care homes reduced from 16 to 4. Finally, the total number of deaths recorded last week from all causes was 40 below the 5-year average for the same time of year. And this is the second week in a row that the total number of deaths has been below that 5-year average. National Records of Scotland has also published today a report on the breakdown of COVID death by ethnic group. And it concludes that deaths amongst people from the South Asian ethnic group were almost twice as likely to involve COVID as deaths in the white ethnic group. That conclusion is reached after accounting for age, sex, deprivation, and whether people live in urban or rural areas. We don't have sufficient evidence to say that deaths among people in any other ethnic groups were more likely to involve COVID. Now, you might remember that Public Health Scotland looked at this issue back in May, and at that time it found no evidence at that stage of a correlation between ethnicity and death rates. But today's NRS report has been able to cross-reference death registrations with the 2011 census data, so it is more comprehensive, at least in relation to registered deaths, than the earlier study. This new data will be considered by our COVID and ethnicity expert reference group, which meets tomorrow, and their views will help us to consider what further action is required. Overall, these weekly statistics confirm what our daily data has been telling us. Scotland has made real and sustained progress against this virus. However, these numbers also speak of heartbreak for too many people. We can take comfort in the trend of recent weeks, but every single death is a tragedy, and I want to send my condolences to everyone who is grieving the loss of a loved one. I also want, as always, to thank our health and care workers and indeed all of our key workers who have been so magnificent throughout this crisis. Tomorrow, I will give an update to Parliament at the slightly earlier time of 12:20, and I hope then to confirm that Scotland can move from phase 2 of our route map out of lockdown to phase 3. And in a few moments, the Cabinet Secretary is going to confirm some changes for those who are shielding, changes which will take effect at the end of this week. And as we make changes in wider society, opening up hospitality, allowing more people to meet up outside, travelling outside our local communities. It is, I think, really important that we remember that there are thousands of people in the shielded category for whom life remains severely restricted right now. They cannot go for a drink or a coffee, and even more significantly, in some cases, they've had to physically distance from their own households for the last 3 months. So we must not underestimate how difficult this period has been and indeed continues to be for them. And that perhaps gives some context and perhaps a sense of perspective to the main issue that I need to address today, which relates to international travel, and particularly the requirement to enter 14-day self-isolation or quarantine when you return to or enter Scotland from countries outside the UK and Ireland, because Ireland has never been included in the UK quarantine arrangements. You will recall from some weeks back that as a result of the genome sequencing of the virus, something that we discussed at a briefing before, we now know that many of the strands of COVID introduced into Scotland came here through overseas travel. In particular, they arrived as a result of travel to and from mainland Europe in late February and early March. Since then, of course, 4,173 people in Scotland have died, and though these numbers are increasing far more slowly now, and the numbers of cases each day now is very small, we should never forget the potential of this virus to do serious harm, both in lives lost and also, as is increasingly feared, in longer-term damage to health. And as we look ahead now, we must be aware that one of our biggest risk factors as we suppress the virus here is the importation of new cases to Scotland that then, of course, have the potential to spread. And that risk is illustrated very well, I think, by the situation in Australia just now. Melbourne, its second biggest city, has gone from virtual elimination of the virus to a new 6-week lockdown in a very short space of time. And while there are still investigations of that underway, there are indications that this may well have been from cases coming into the country. It's also the case that one of the criteria that we must satisfy ourselves of for our move to phase 3, one of the criteria set out by the World Health Organization, is the need to, and I quote, manage the risk of exporting and importing cases from communities with high risks of transmission. And this is an issue that becomes more and more important as fewer and fewer people in Scotland have the virus. On the other side of that, I know and am acutely aware of how important international travel is for our tourist sector and for the aviation industry. So these decisions are really difficult, not least for a government like ours that celebrates free movement and cherishes Scotland's reputation as open and welcoming. And we do not take these decisions lightly. On Friday, the UK government published a list of 59 countries and territories for which it would no longer, for England, impose quarantine restrictions. The information underpinning that list separated countries into a green or low risk category and an amber or medium risk category. In the green category are 39 countries or territories which either have very low rates of COVID or very small populations and are therefore considered low risk. And in the amber category are 20 countries where the risks are considered to be greater and so classed as medium. These green and amber ratings are decided on the basis of two factors. First, the prevalence of the virus in each country, and second, an assessment of the current situation based on things like numbers of new cases and local outbreaks conducted initially by Public Health England. Thanks to the efforts that all of us has made, as we know, Scotland now has a low and declining prevalence of COVID. And I'm going to refer to this issue of prevalence a little bit, so it's worth stressing that these estimates change regularly and they always have ranges attached to them. So when I quote figures, I'm always quoting the middle number in our estimated range. And our current central estimate for Scotland right now is that for every 100,000 people in the population, 28 have COVID. That's a prevalence of 0.028%. So we're not yet at the stage where we can say we've virtually eliminated the virus within the community, but that prize is clearly attainable. And it brings with it, of course, the prospect of a much brighter future and more sustainable recovery, including in particular the full-time return of education in August. Now, Scotland's position is a bit different from that of the UK as a whole. Across the UK, it's estimated that around 180 people in every 100,000 have COVID. So that's higher than the 28, which is our estimate for Scotland. And this is relevant to the decisions we take on the relaxation of quarantine. Now, amongst the countries that the UK government has rated as amber, quite a few, including, for example, Denmark, Greece and the Netherlands, have a prevalence range which is lower than Scotland's. However, there are others, such as Spain in particular, that have a significantly higher prevalence. As reported by the Joint Biosecurity Centre, the prevalence of the virus in Spain is around 330 people in every 100,000. Now, that means the rate reported for Spain, while it's less than twice the rate for the UK as a whole, is more than 10 times the estimated rate for Scotland. And this variation in the amber countries feeds into the decision that we are making today. Alongside prevalence, there's also an assessment of risk, and the 4 CMOs agreed last week to do some further work to improve the methodology behind the risk assessments for each country, ensuring that a wider range of factors can be considered and that we can effectively assess whether outbreaks in different countries are being effectively contained. And once that work has been completed, which I hope is within days, we hope to be able to make more targeted assessments in future, taking greater account of how different countries are managing to control the virus. The decision we are making today, though, it does make some distinction between countries given green and amber status by the UK government, and let me set out that decision. I can confirm that from the 10th of July onwards, if you're travelling to Scotland from any of the 39 places the UK government has rated as green, we will not require you to self-isolate upon arrival in Scotland. A full list of these countries will be published on our website, but they include, for example, Germany, Austria, Norway and Malta. Australia is also on that list, so let me just mention that now. Despite the recent outbreak in Melbourne, though, which I've talked about, it is still assessed to be a low-risk country because, as I mentioned, they have acted quickly to impose a strict localised lockdown, so people in Melbourne can't travel. We will also lift quarantine for the countries on the amber list that have a prevalence below or not significantly higher than Scotland. And that list includes France, Greece, the Netherlands, Italy and Poland. However, unfortunately, and I do mean that because this is the hard part of the decision, we cannot, in good conscience at this stage, lift restrictions on people arriving from Spain because of the significantly higher prevalence. We also have concerns about Serbia, where a recent outbreak has led neighbouring states to close their borders with that country, and the impact of that outbreak will not be seen in the data for a couple of weeks. So the decision the Cabinet reached this morning is that the quarantine requirements cannot be immediately lifted for Spain and Serbia. Now, let me be clear, I hope that we will be able to add Spain and possibly also Serbia to the exemption list, either in full or perhaps in part, at the next review point, which is on the 20th of July. And to that end, we'll be liaising closely in the coming week with the relevant authorities, as well as with airports and airlines, to gather more information on control of outbreaks and prevalence and what other mitigations, such as testing, we could possibly put in place as an alternative. Now, this has been a very difficult decision, but as I hope I have demonstrated today, and I know I've taken quite a bit of time to do it, it is evidence-driven and it is motivated only by a determination to protect Scotland as far as possible from a resurgence of this virus in the weeks ahead. Now, let me make 3 further quick points about this. Firstly, all countries are keeping these issues under review, so depending on developments with the virus, they are subject to change, including the re-imposition of quarantine, including at short notice. So you should always be aware of that if you are making plans to travel. Secondly, for the future, we are looking closely at whether there are alternative measures that could replace or reduce the amount of time an individual is required to quarantine, and we'll seek to discuss these with airports and others over the next few days. And the third point I want to stress, because there is a misconception about this, you cannot get round the requirement to quarantine in Scotland by flying to or from an airport in England. Public Health Scotland will have access to contact details for people staying in Scotland, regardless of whether an individual arrives at Glasgow, Manchester or London, and it will carry out sample checks. Those sample checks, as you will have heard, started yesterday. This decision, which, as I say, has not been easy for the government to reach, is also not an easy one for many in the travel, tourism and aviation sectors. And I know how many people from Scotland enjoy travelling to Spain, and I know how much we love welcoming Spanish tourists. So my hope is that these restrictions can be relaxed soon, and possibly very soon. But at present, this is the best balance we can arrive at between enabling greater freedom of movement and protecting public health, which is so important given the risks that we face. Now, I'm aware that this has been quite a detailed statement, and as I say, an up-to-date list of countries and territories from which you can, as of Friday, travel to Scotland without quarantine will be published on the Scottish Government's website. Let me stress, though, that just because you don't have to quarantine when you come to Scotland from these countries, it doesn't mean you don't have to comply with all of the other rules and guidance in place here. You do. Now, I'll hand over to the Cabinet Secretary in a moment to talk about shielding, but before I do, just let me emphasise exactly the advice that we are asking everybody to follow, the facts advice. Face coverings in shops and public transport and other enclosed spaces, avoid crowded places, clean your hands and hard surfaces, 2-metre distancing and self-isolate, and book a test if you have any of the symptoms of COVID. If we all stick to these 5 measures, whether we live here or are visiting Scotland, if we all stick to these 5 measures, we minimise the risk of the virus spreading again. Thank you for listening and for bearing with me through what I know was not just a lengthy but quite a complex in places update. But I do believe it's important to share as far as possible, not just the decisions we are reaching, but the evidence and the process of decision that underpins them. But with those comments, I'll hand over now to the Cabinet Secretary, and I know those in the shielding category watching will be anxious to hear what she has to say.
Thank you very much, First Minister. This afternoon, I want to talk directly to those who are shielding about the next set of changes that will be introduced for you. As you know, on the 8th of June, we asked you to shield until the 31st of July at least. But we also announced that throughout July, we would ease our shielding advice as the evidence allowed. Because infection rates across Scotland have continued to fall, I'm pleased that we can advise some important changes today that will be effective from the 10th of July. As I know you understand, many of the recommendations for the general population are not yet right for you if you're shielding. We're changing our advice for you gradually, most importantly because we want you to stay safe, but we also want you to feel comfortable as you come out of shielding. So the changes we are making are as follows. From Friday, if you are shielding, we no longer advise you to physically distance yourself from the people you live with. I know that for many of you, doing this has been extremely difficult and has been painful. And I hope that this change allows you to resume a more normal and a more relaxed life with those who are closest to you. If there are children in your household under 12, they no longer need to physically distance from other children outside, as long as those other children are not shielding. I also know that those of you who are single parents or living alone have missed the support of family and friends. So also from Friday, if you're shielding, you can now form an extended household. What that means is if you're living alone or living only with other people who are under the age of 18, you can join another household. You and the members of that extended household do not need to physically distance from each other, and you can stay the night in each other's houses. And of course, many of you who are shielding also support your loved ones. So this means you can care for children under 12 within that extended household, again, without physical distancing. I need to stress that households must partner exclusively. You can only form an extended household with each other. And also from the 10th of July, you can book holiday accommodation or go to a second home, provided neither has shared facilities. This is in line with the travel restrictions lifted across Scotland last week, and I hope many of you can take advantage of the change. However, we do strongly advise that you only do this with people you live with or with whom you have made that extended household. Finally, if you're shielding, we can now advise that you can meet up with 2 other households outdoors rather than one. Our advice now is also that you can go inside to use the toilet of a household you might be visiting outside, or allow a visitor to go into your house to do so. We still advise that you meet in groups of only 8 people and don't meet any more than 2 households each day. Tomorrow we will give you more detail on what more you can expect to hear from us over the month of July. And from tomorrow, letters will issue to all of you outlining the changes that I'm making and announcing this morning. I hope the changes that we have announced and those that I hope will continue to come will help to ease what I know has been an extraordinary burden that shielding has placed on you over the last few months. I can't say enough to express how grateful I am to you for following the advice. It's been stressful. I know at times it has felt frightening, and it has been very restrictive. Right now, we can begin to ease those restrictions because of the falling infection rate. Right now, if you follow precautions, our clinical advisors tell us that the risk of you catching the virus is low. That's very different from the start of the pandemic, as you well know. I hope that you are able to resume much more of your lives that you have been advised to be able to do in the last few months. If you work, our objective of moving slowly and carefully towards the end of this month, where we hope that we will be able to pause shielding. If you work, you could return to COVID-secure workplaces with physical distancing, and children who are on the shielding list could return to school at the same time as their classmates. I know that what I've outlined is positive news for many of you, but I also know that for some it might be daunting. And if you want more information about the risks you face and what you can do to live safely, that information will be available on the NHS Inform website, as well as in the letters that we will send out to you. But finally, I want to reassure you of 2 things. Firstly, we will only advise that you can stop shielding if the evidence supports it. And secondly, no matter when the advice to shield ends, you will have guidance and support to help you transition back to as close to your pre-COVID lives as possible. And the last thing I want to say is to those who are watching who aren't shielding, please do continue to follow the rules and the guidance that has got us all this far. It doesn't just keep you safe, it will allow shielding for your neighbours, your friends, those in your community. It will allow shielding to come to an end as soon as possible. And it will give those who are shielding the confidence that they can go back to live their lives safely. Thank you.
Thanks, Jeane. And I'm aware that, particularly for those in the shielded category, that is a lot of information to take in at one time. So there will be more information on what the Cabinet Secretary has just outlined there available on our website. But I hope these changes will help you get back a quality of life that is better than has been the case in the last few months. Now, we're also joined by Jason Leitch today, but Jason is going to help us answer questions, but we're now going to go straight to questions. So Nick Sheridan from BBC.
Good afternoon, First Minister. What conversations have you had and what cooperation are you expecting from foreign countries when it comes to these follow-up spot checks? In other words, if a person flew into Portugal or France and entered Spain, spent a week there, and then flew back from Portugal or France, how would you know about it? A quick question, if I could, for the Health Secretary on the Cumberledge review into mesh implants and other treatments. Although the recommendations apply to England only, the Chair has said that she hopes the devolved governments will consider them. Will you look at implementing the recommendations in this review?
I don't want to complicate this because it can get very technical. The answers to many of these questions are in the regulations, and we'll help people understand these. But the regulations, certainly as I recall them right now, are that the quarantine requirements apply to you if you start out in a country to which they apply, even if you travel through a country that they don't apply to. Now, in the previous regulations, that was the countries in the common travel area, but obviously that list of countries to which quarantine doesn't apply is now wider. But you can't, it's really important to, and I've made this argument, or made this point rather, in terms of the England-Scotland issue. you can't get round these quarantine arrangements by just deciding to fly from or to somewhere else. And nor should you try to get round them, because they are here for a really good reason, to try to protect us as far as possible from further spread of the virus. And as I say, within the UK context, the information that Public Health Scotland will have, it will include people. So if you go to Spain and you travel from Manchester and come back to Manchester, but you're coming home to Scotland, then that information will be shared with Public Health Scotland. So you will be included in the checks that are done. And crucially, the law will require you to quarantine here for 14 days. Hopefully, we will change that in the not too distant future, but that will be the position for the next couple of weeks. Jeane, do you want to take the mesh point?
Yes, thanks very much. It is a really important question, and I know that many women and indeed clinicians across Scotland will be very interested in this. We will certainly, and have begun the exercise, to look in detail at the recommendations and take a view on their appropriateness and their application here in Scotland, and I hope that we will complete that exercise very quickly. Some of the recommendations follow some of the actions that we have taken, for example, around financial support for women who've experienced mesh complications and who require additional financial support because they have suffered a loss. Others, including a recommendation that the Medicines and Healthcare Products Regulatory Agency needs to look further at how it conducts its regulation work. We have asked for over a year now, but nonetheless, taken as a package, some of the recommendations align with what we are either doing or have asked to be done, and we will look at all of them in the round and take a view on the implementation and the appropriateness of them for women here in Scotland.
Louise Scott from STV.
Thank you. Can I ask what has changed in the past 5 days that now gives you confidence to give the go-ahead to the majority of the list that was issued by the UK government last week in terms of destinations? And just also, how often will the Scottish government review the list of countries and how quickly could they change? So, for instance, if someone was on a 2-week holiday, could that mean they have to self-isolate on return to Scotland if guidance changed midway through that holiday?
Okay, I mean, with respect, many of these questions, the answers to these questions are pretty obvious from what I've said over the past few days, and also from the regulations themselves. So in terms of what has changed is we have completed our assessment of the list against our assessment of Scotland's prevalence here. So as I keep pointing out, we cannot simply rubber stamp a list that comes from the UK, which is based on decisions that take account of prevalence in other parts of the UK, because right now prevalence in Scotland is significantly lower than in the other parts of the UK, so we have to make that assessment ourselves. We've also tried to get more up-to-date information than was contained in the data from last week, and we've now concluded that assessment and took the decision at a meeting of the Scottish Cabinet this morning. So that's the proper and responsible way in which any government should take a decision. We're not a rubber stamp for decisions taken by other governments when there are considerations that have to be taken account of that are unique to Scotland's circumstances. In terms of the question about review, we have a statutory obligation to review the regulations on a 3-week cycle, similar to the overall COVID regulations, and we will do that. So this is not actually, we've taken a bit of time beyond the last review point to come to this decision. So it's not 3 weeks until the next review point. The next formal review point is actually the 20th of July, and we will make a further consideration then. And this is the difficult but important point, every country will reserve the right to take decisions very quickly if necessary. If there is a sudden surge in infection in a particular country, then we will perhaps, hypothetically, very quickly have to reimpose quarantine arrangements here. And there is no country that will rule that out right now, and nor should they, because of what we're dealing with. So as I said in my speech, the scenario you outlined there about somebody going on a 2-week holiday, I hope that wouldn't happen, but it would be wrong for me to give a guarantee of that, which is why I said in my opening remarks that people should be aware of this when they are making plans to travel. And it's really important that we're frank about these challenges. As I've said on a number of occasions in relation to a number of different aspects of this, there's nothing I would love more right now, other than a crystal ball, is and a magic wand is certainty, and that would come from the crystal ball, I guess. I don't have that certainty. Nobody does. We see in Australia right now, Melbourne, just a couple of weeks ago, seemed to be like we are right now, almost in the point of elimination. It's now in a six-week lockdown. So this is rapidly moving, and we've got to be able to respond in order to keep our country as safe as we possibly can. And people have to be aware of that in the context we're in. Jason, do you want to say a bit more from the clinical point of view about why these quarantine measures, while regrettable because nobody wants them in place, are nevertheless an important part of what we have to have in place?
I would draw a distinction, initially a distinction I've had to draw here a number of times, between advice and decision. But the public health advice here is relatively clear. The World Health Organization say that as you come out of lockdown in the 194 countries who are doing that process, you should control your outbreaks. I think you've seen evidence in the last 10 days of Scotland doing that. You should have test and trace in place, and we have test and protect working and in place. And you should control the importation of new cases, or the risk of importation of new cases. So the public health advice to the First Minister and the Cabinet is we have to make some kind of judgment about where those high-risk places are. Some of that is straightforward. Some of that is red countries where it's perfectly clear that the risk is high. Some of it is green and the risk is the same as our country, and therefore we don't believe there is a risk. There is a middle ground there, and that's why you can see in the First Minister's speech the challenge with making those choices. But the public health advice to the First Minister and the Cabinet is very, very clear. It is absolutely crucial that we control the importation of potential new cases into the country because they could very quickly get out of control.
Thanks. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, the Border Telegraph is reporting today on the basis of a Freedom of Information request that 68 patients were moved into Borders care homes between February the 28th and April the 25th before tests were required for COVID. Now, they also report that the Health Board believes that no transfer of COVID from hospitals to care homes took place. But on the back of this, John Lamont, a Tory MP for the Borders, says this shows, and I quote him, how negligent the SNP were on care homes. Would you care to respond to that?
Actually, part of me just wants to treat that comment with the contempt I think it deserves. And John Lamont is a member of Parliament in the House of Commons. He will have no doubt heard his own Conservative colleagues grappling with the same issues. And there is, in terms of the issues around care homes and hospitals and trying to minimise delayed discharge to protect older people from being in hospitals when there might have been COVID, we were taking the same kinds of decisions. So I just think that is an attempt to politicise something that is both inappropriate, and actually anybody with even a scrap of knowledge about this, and I don't know whether that includes John Lamont or not, would know that just doesn't bear any scrutiny whatsoever. The issues around care homes, and I would just draw attention to possibly the most important part of your question to me there. The Health Board doesn't believe there was any transmission from hospitals into care homes. I haven't seen the Border Telegraph or the particular FOI, so I won't comment too much on the detail of that. We had very difficult decisions to make. We took those decisions on the basis of the best knowledge and evidence we had at the time, and we have put in place lots of things to protect care home residents. The death toll and the toll overall of COVID on care homes has been awful, and I would be the first person to acknowledge that. And there will be lessons that we all have to learn from that. But these are lessons that we will all have to learn from that. And anybody trying to make this an issue of party politics, I think, to use a phrase I used last week, should really take a long, hard look at themselves in the mirror. Phil MacDonald from Global.
Thanks, First Minister. The Chancellor is just announcing his economic support package just now, and he's announced £2 billion to create jobs for young people aged between 16 and 24. Completely understand you won't have had a chance to see all the details yet, as it's still ongoing, but I know this is something that you were quite keen to use here in Scotland. So do you think this will be enough to prevent the mass unemployment or the mass lack of jobs that you fear? And can you perhaps paint a picture of how it will work in Scotland?
So as you quite fairly point out, the Chancellor, I think, is on his feet right now, so I'm not obviously watching him, although my Scottish Government colleagues will be. So I'll wait and see the detail of what he has announced before responding formally. The particular proposal around job guarantees for younger people was partly trailed in the media, so I have some sense, if that reporting is accurate, of what that is likely to be. At a first glance, I would say I welcome it. I'm not sure it goes as far as the job guarantee that the Benny Higgins report recommended for Scotland and that we are currently considering, but it looks as if it potentially could play a part and make a contribution to that. So we will look at the detail, and then before the end of this month, as we set out our response to the Economic Recovery Advisory Group report, the Benny Higgins report, as I've referred to, we will set out more about how we see a job guarantee overall applying in Scotland. And as I say, it sounds as if this may play a part in that, but will not necessarily be the whole story. And beyond that, I'll see as soon as this briefing is completed what else the Chancellor has had to say. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Firstly, I just want to ask quickly about air bridges. Have you had, or has the government had any discussions with other countries about reciprocal arrangements? Because as it stands, places like France have got sort of quarantine measures in place for people in the UK on a reciprocal basis. So will that be the same for Scotland? And then quickly on childcare, today the government has announced that the free childcare expansion won't be taking place for at least another year. Do you have any message for parents affected by this?
On the reciprocal issue, we want these arrangements to be reciprocal. I know the UK government has had discussions and said something about that, and we will continue those discussions going forward as hopefully this is a situation that develops further with more countries able to have quarantine-free travel. On childcare, look, I'm deeply sorry. The expansion of childcare is one of the commitments of my government in this term of Parliament that mattered most to me, because it is so transformational in terms of the opportunities and the attainment of young people later in education, but also is a massive financial benefit to parents. So I deeply regret that it has to be slightly delayed, but because also it was on track to be delivered, and it's a massive policy, so that was no mean feat in itself. But I hope people will understand it is just inevitable. We've had delays around all sorts of activity, including construction activity. We've had councils very much in the leadership of the implementation of this policy having to divert resources to dealing with COVID. So for a variety of these reasons, a delay is just inevitable, but also regrettable, and we will, as quickly as possible, get it back on track and deliver it as quickly as possible. And I remain just as committed today as I was pre-COVID to fulfilling this commitment in full, so that children and parents get the fullest benefit from it as quickly as possible. Daniel Sanderson from The Telegraph.
Thank you very much, First Minister. Could you please explain how Spanish tourists to the UK would be expected to know about the different regulations, given they may not even speak English, let alone be following the UK media or watching these briefings? Could there be Spanish information put on flights or trains between England and Scotland? And also, could you just explain a little bit more about enforcement? I would have thought if there's a flight between England and Spain that the passengers returning wouldn't have to fill in the forms that are currently used. Obviously, I might be wrong about that, but could you just explain how that will work? Thank you.
I hate to point it out to you, but you are a bit wrong about that, but I'll come on to that. Look, I'll try and make this as simple as possible. Firstly, passengers have been made aware of the requirements. This is a global pandemic. I think passengers, including Spanish tourists, are aware of the fact that there are different requirements in place. And I think everybody right now who is planning to travel from wherever to wherever is well advised to make themselves aware of the rules in place in the country that they're visiting. And I want as soon as possible to get back to the position of welcoming Spanish tourists with no restrictions at all, as I'm sure we all do. I guess this is perhaps more particularly relevant for Scottish people who might be keen to go on holiday to Spain, that they understand that if they do, as things stand at the moment, they would require to quarantine for 14 days when they return for the reasons that I have set out. In terms of the, and I'll be corrected by the UK government if I'm wrong about this, but the lifting of quarantine is the lifting of the self-isolation requirement. It is not the lifting of the requirement to give your details as you enter the country. That requirement is still there. And for people travelling to Scotland, either people returning home to Scotland or people coming on holiday to Scotland, even if they travel through an English airport, they will be required to give that information, and that information is then shared with Public Health Scotland. And we've had obviously discussions in the last couple of days about the period of time it took to get that memorandum of understanding in place to allow that data transfer. And as of yesterday, Public Health Scotland do spot checks on the basis of that data to check up on how people are, but also to be alert if there are issues around compliance. These are, I understand for people, these are not easy arrangements either to get your head round from the point of view of none of us like living under these restrictions, but also the detail of them. So we will try, as we do in all of these things, to put as much information as simply as possibly into the public domain as we can. But there is also, on all of this, there are obligations on all of us as individuals. So if you are planning to go overseas on holiday right now, and given everything that's happening and given what we're seeing elsewhere in the world and what we've been through here, I think that's something people probably want to think quite carefully about right now. And of course, there is the opportunity, as I've said a couple of times, to support the Scottish tourist industry by having a staycation instead. But if you are planning to travel, then make sure you understand the rules and regulations and the uncertainties attached to this, because that is just, I'm afraid, the reality of living with a pandemic that by its very nature is uncertain. Mark McLaughlin from The Times.
Good afternoon, First Minister. On the air bridges, does that include the popular Spanish islands like the Canaries and Ibiza? And the Chancellor's announced a stamp duty holiday. Will we get an LBTT holiday in Scotland?
On the latter point, I'm sure you will allow me to take a bit of time to consider the detail of all of the Chancellor's announcements and discuss these with the Finance Secretary and others. And we'll set out where there are decisions for us in some of the decisions he has announced, we'll set that out quickly. The Finance Secretary has a statement in Parliament tomorrow as a response to the Chancellor's statement today. On the question about air bridges, yes, it does at the moment include Spanish islands as well as the mainland, so all of Spain. But as I said in my opening statement, one of the things we will be looking at over the next couple of weeks is whether we can lift that exemption for Spain in its entirety, which I would hope to do as soon as possible. But in the interim, if it's not possible to do that, can we get data that would allow us to make a decision about the islands, for example? So I can't give a guarantee on that right now, but it will be one of the things we are looking at closely. At the moment, we don't have enough data that would have allowed us to distinguish between parts of Spain today. I can't guarantee we will in the future, but it will be one of the things that we are considering. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on childcare in schools. With Falkirk Council saying today that all pupils won't be back until the 24th of August, could you give schools and parents some clarity on when you'll make a decision about whether pupils will go back part-time or full-time? And just on the delay to the free childcare expansion, which you say is inevitable because of the pandemic, would it not aid the economic recovery to get the expansion going this year?
Of course we'll try to accelerate that, and I don't just say it's inevitable. I think it's a statement of the obvious that some delay is inevitable given the cessation of much of life that has happened in the past 3 to 4 months. But yes, of course, we will try to accelerate that as much as possible. And you're right, it's a fair point that there is a relationship between our ability to recover capital projects and economic recovery. The only point of, I suppose, caveat I would make to that is that while there are some issues around capital construction here, there are other issues as well, just around the ability of local authorities to deliver this. So we will try to minimise that delay as much as possible and take any opportunity to accelerate that. On the schools point, the Education Recovery Group chaired by the Deputy First Minister, is considering all of these issues, and he will report on them. He's making a statement to Parliament, if memory serves me correctly, next week or the week after it might be, to give an update on this. We have always said that because full-time return to school, which is absolutely our intention if it is possible, depends on us continuing to suppress the virus, and that's why the caution I'm taking around some of the issues we're talking about today is so important, because, you know, frankly, taking a bit longer to get back to being able to go to Spain on holiday, if that helps us get to the point of full-time education, then perhaps that is a balance that is not a bad one. So we will update as we go, and then obviously we need to assess the situation closer to the date of return to make sure that we consider it is safe to do so. The Falkirk situation and local authorities obviously are the statutory providers of education, so they have responsibilities here. As I understand the Falkirk situation, it's about taking a few days at the start of the term to ease children who won't have been at school for 4 months into it in a particular way, rather than going back to full-time education right at the outset. But it's not a step away from the aspiration of full-time education. But all of these issues will continue to be fully considered, and it's important over the summer that parents are kept fully updated too. Tom Peterkin from the P&J.
Good afternoon, First Minister. It's been reported this morning that up to 106 jobs at the McDonald Hotels Aviemore Resort, which employs 150 people, are under threat. And there are also reports that those living on the site, there's a fear they could become homeless. Can you offer any support to these people or this business at the moment in this troubling time?
We'll be trying to offer whatever support and help we can to the company, but as you rightly say, to employees who, again, you rightly say, for some of them it's not just their jobs that are affected here, it's also their accommodation. The Tourism Minister, Fergus Ewing, has already met with McDonald's Hotel and offered the support around PACE, our employment initiative, and will be engaging to try to help with these other issues too. You know, this is an incredibly difficult time for hotels and other parts of the hospitality and tourism sector. For a company like McDonald's Hotel, it's not just tourism. I know that there is an impact from big scale events and conferences not being possible at the moment right now. So we will work with individual companies and sectors as closely as possible to try to provide as much help as is feasible for us to do. Of course, and I'll confirm this, I hope, in Parliament tomorrow, but the move into phase 3 will allow us to open up tourism from the middle of next week, the 15th of July, which will not solve all of the problems for companies like McDonald, but will start to allow them to welcome back guests, and that allowing companies to get trading again and to start to do business and make money is obviously the key thing that we're seeking to try to do, but do it safely and sustainably. Paul Hutchins from The Record. Oh, Paul Hutchins, I am told, is not with us today. I will go to Tom Martin at the Daily Express.
Hi, thank you, First Minister. Just briefly returning to schools and the situation in Falkirk. I mean, it is a 2-week gap between the new term starting and pupils going back full time there. And parents groups have said this means your plans for getting kids back are falling apart. I just wondered if you could respond to that claim, and is there nothing the government can do to actually sort of give a bit of more centralised directions to councils on this?
Well, that is what is happening through the Education Recovery Group, and these things will continue to be discussed. All of these issues are difficult, you know, because we are dealing with a pandemic, and the uncertainties inherent in that and the risks inherent in that make all of this difficult. We've also got a situation where children have been out of school, unfortunately, for 4 months. So all of these things have to be taken into account. But our objective is to get children back to education full-time in August. And as I say, that becomes more possible the more successful we are in keeping this virus at the kind of levels we've got right now, which is why you might think I'm going too slowly on other things. Part of my consideration right now is how do we give ourselves the best possible chance of getting children back to school, and we'll keep very focused on that. Gina Davidson from The Scotsman.
Thank you, First Minister. Last month, Jeane Freeman, your Health Secretary, said that the government was actively pursuing a long-term solution for staff parking at the 3 PFI-owned hospital car parks in Scotland. Given that obviously it's suggested it down south that free staff parking during the COVID pandemic is about to be scrapped, can I ask what the situation is here in Scotland now and how far along the road this solution is?
Jeane Freeman, my Health Secretary, happens to be standing next to me, so I'll hand straight over to her to address the important issue. And of course, we, in the main, NHS car parks are already free. We have an issue with 3 PFI hospitals.
Thanks very much. In fact, just on that latter point, the NHS car parks, with the exception of 3 of them, have been free for staff, patients and visitors since 2008, and that has saved those individuals a total of £41 million. The free parking for staff in particular in those 3 PFI car parks that we introduced has been extended for a further 3 months to the end of September. Meantime, we continue to have discussions with the operators of those PFI car parks in the hope that they will understand that actually putting what is right for staff and patients and visitors is important, not simply to continue to operate those car parks and consider their profit levels. So we will continue to have those discussions that have been positive in the main so far to see what more we can do with the 3 PFI car parks out of all the NHS car parks that continue to charge. But right now, no charges until the end of September.
Thanks. David Ball from the Herald.
Thank you, First Minister. Hospitality businesses led by the North Highland Initiative have written to the Health Secretary to ask if widespread testing could be rolled out for staff ahead of the July 15th reopening date. They've pointed to spare capacity at the Inverness UHI test centre. I was just wondering if that is something that is being considered to give sort of staff and visitors confidence when the tourism sector reopens.
I haven't seen that letter. I'm not sure if the Health Secretary has, so I think probably it's better we look at it. Obviously, we have our testing strategy in terms of testing people who don't have symptoms continues to develop, and we will take account of any representations that are made. But as we saw in Dumfries and Galloway last week, we have the ability to move testing capacity where there are concerns, and that included widespread testing of particular workplaces and parts of the community. So, but given that neither of us have seen that letter, I think it's possibly better that we look at it and then give you a response when we've had the chance to read it. Last question today is from Rachel Watson from the Daily Mail.
Thanks, First Minister. I wondered if I could just go back to the air bridges and some of the points that have been covered to follow up. On people who are away on holiday, you say things can move quite quickly. Should people factor that in when they're booking? So, for example, should they think about the fact that they may need to take 2 weeks off work to self-isolate when they get home when they're booking, even if that's not where they are when they book it? And also on the point about people coming from, for example, Spain, having differences in Scotland and England, will there be any sort of information campaign, or are you just relying on passengers looking that up before they travel?
One of the things we're looking to do as part of a package of measures that may in time be an alternative to quarantine is about information, but we will also be taking all reasonable steps to make sure that people are aware of the regulations and the rules in Scotland, particularly but not exclusively where they are different from England. Remember, the key driver of this is a very important difference between Scotland and England right now, and that is the prevalence of the virus. 28 people per 100,000 in Scotland, we estimate, versus if I'm getting this figure correct from my earlier remarks, 130 per 100,000 in England. So that different prevalence is driving some of these different decisions. And in terms of the first part of your question, look, I can't make individual decisions for everybody across the country, and nor would you want me to. I feel as if I've been probably doing too much of that over the past 3 months. But all I would say to people is you have to be aware that while we've got prevalence quite low in Scotland right now, this virus is still there and it's still a risk, and it's going to cause uncertainties for quite some time to come. So you have to be aware if you're going to travel overseas, and this is not unique to Scotland, this is the same for the UK and for all countries, that developments in the virus could lead to a situation where decisions are taken quite quickly. Now, hopefully that doesn't happen, because hopefully we continue to see the virus decline. But in many parts of the world, it's still increasing. In some parts of the world, it's increasing again, having started to decline. So that's just the nature of what we deal with. If I'd been standing here a week ago, based on the data I'd seen, I would have had the concerns that I've had today about Spain. Certainly, that's not changed. But I wouldn't necessarily have had Serbia on my radar screen a week ago, because we've seen quite a recent development in Serbia, particularly around Belgrade. So these things do change quickly. And other countries will be looking at changes as well. So if, heaven forfend, because I desperately don't want this to happen, but if we see things starting to go in the wrong direction in Scotland or other parts of the UK, other countries will have to make decisions. So this is just a feature of life at the moment. We're talking about it here in the context of international travel, but it's going to be a feature of life in many different respects. Right now, we're in a phase, as are many countries, of trying to limit spikes and resurgences as we come out of lockdown. We've effectively locked this virus down for the last 4 months. So as we ease that, the danger is spikes, and some countries are seeing that. They can happen by people not abiding by the rules at home, but they can also happen by cases coming in. Obviously, as we go into the winter, it's a related but slightly different risk, because that is about a new potentially winter wave of the virus. So this is going to be a feature of our lives for some time to come, and it's going to cause inconveniences for us. I know that. But those inconveniences, as we found out over the last 4 months, are as nothing compared to the grief of losing somebody to it. And I would ask people, if you're feeling frustrated about any of this right now, if you're feeling, I was going to use a term I shouldn't there, if you're feeling upset at me because you don't have the certainty of being able to go to Spain on holiday over the next few weeks, then all I would ask you to do is remember the context of this. This is about trying to stop people getting a deadly and damaging virus, and trying as far as possible to minimise any further loss of life. With that, we have concluded the questions. Thank you to Jason and to Jeane, to Yvonne, our BSL interpreter today, and as usual to the journalists. And thank you to all of you both for bearing with us during our longer than normal opening statements. I hope particularly for those in the shielded category, today's update has brought you some welcome news. For people perhaps wanting to go on holiday to Spain over the next few weeks, less welcome news. But please be assured that all of the decisions we are taking right now, many of them are very, very difficult, and they lead to difficult circumstances for all of you. But they are all being taken from the point of view of trying to keep this virus at bay and under control. So I would ask you to remember that. But most importantly of all, I would ask you to remember the 5 key things we need everybody to do to give us the best chance of keeping it under control. So face coverings, already mandatory in public transport, will be mandatory on Friday in shops as well. So start thinking now, if you're not already wearing a face covering in a shop, the law says you will have to do so on Friday. Avoid crowded places, indoors or outdoors. Clean your hands regularly, clean any hard surfaces you touch. 2 metres distancing remains the general overall rule, and self-isolate and book a test immediately if you have any of the symptoms of the virus. And if we keep all of us doing all of these things, there are no guarantees about the future, but we give ourselves the best possible chance of keeping this thing under control. So my thanks to all of you. As I said earlier on, will not be here in St Andrew's House with you tomorrow. I will be giving an update in Parliament. It starts at the slightly earlier time of 12:20, but I hope you can join us then, when I'll set out, hopefully, the move to phase 3 and what that entails over the next few weeks. But in the meantime, thanks for joining us today.